about that. And over the last several years, we've become really focused on improving community outcomes related to educational outcomes, financial stability outcomes, and health outcomes. And so when you hear about the stories, exactly like you heard from Bonnie, about how important health insurance, and children's health insurance in particular, is to about the health outcome, to the educational outcome, and the financial stability of the family, it was an easy thing for us to sit down and join not only the Cindy and her team and Secretary Sebelius, but the 16 other partners that are sitting here. We have 100 United Ways that are prepared to go out there, and we're going to grow that number to go out and do several things. One, we're going to look at, how do we continue to advocate for streamlining and reducing the red tape. So you heard some of the examples in terms of the express eligibility, the notion of kind of presumptive eligibility and making sure people aren't dropped. And so we'll be continuing to advocate that through our public policy and by the fact that United Ways connect folks to that. And the other way we'll be doing it is getting information to families, and we'll be kind of in a number of different ways, but three in particular to highlight. One is because we work in communities with community health clinics and out-of-school time programs and schools and a bunch of other food banks and food pantries, we're going to get information to families so that they know how to potentially apply for it. In addition, we've got one of the big things that we do to help stabilize people's finances is we help people apply for the Earned Income Tax Credit, and we'll be in one-stop shops in other places where we do that. We'll be expanding it to ensure that benefits enrollment, not only in this program, but other programs like SNAP or formerly food stamps, so that people have access to nutrition and children's health insurance. And then finally, most importantly, United Way, with a number of other partners, runs 211, which is an information and referral system available in 80% of the country, where people who are having crisis day to day can call up and get connected to community resources. And so we'll be working with, as we heard even with some of the Urban Institute's great research, to begin to ensure that those operators know how to screen and follow up with folks that call and are talking about the issues related to this. And so we'll be doing that in a number of communities and continuing to grow that network and bring greater visibility to that. So that's kind of a quick answer to that.
That's a very robust program. So, Dr. Palfrey, we know that pediatricians, probably second only to parents, are quite aware of what the impact is when kids don't have health insurance coverage. Can you talk a little bit about what AAP has in mind as it steps up to the challenge?
Well, Cindy, thank you so much, and we're very, we're very proud to be here as one of the 16 partners. As you mentioned, as a pediatrician, there's nothing more